I think the significance of DISC being in Carlsbad is that San Diego is a perfect fit for a place like DISC. We have a lot of very active people here. Patients want not only their spinal disease to get better, pain-free, but they also want to return to an active lifestyle. And so our focus in neurosurgery here has always been to not only help the patient get rid of their pain, increase their function, but also quickly return to a normal, active lifestyle.
Carlsbad is the culmination of a learning curve that's been almost 20 years. And we've learned many things along the way. And realized when we started with much simpler cases, small microdiscs or a little bone spur removal. And now we're doing complex reconstructions and robotic joints for hips and knees and image-guided or 3D-guided screws for stabilization, artificial discs in the neck and the back, much more complicated cases.
We're bringing the best talent in the market together to team together and learn from each other and at the same time apply their skills to our patients.
Our goal was to create one of the highest performing ambulatory surgery centers in the nation, and doing that in a way that's focused solely on the patient. So everything we've done, from designing the flow and the clinical spaces, to the equipment we purchase, to the surgeons that we employ, are all designed and curated to make sure that the patient has the best experience and the safest experience possible.
The Carlsbad market is, a great growth market, and there may be other surgery centers, but what we're offering at DISC in Carlsbad is really very unique in the market as far as the technology that we have, the number of involved surgeons and staff members, and the long-standing kind of track record of the organization doing this type of surgery in this environment.
So in Carlsbad, we have a very unique opportunity. We're partnering with the health center here locally, Tri-City Hospital. And the importance there is that while we're building our environment in the outpatient, we also are creating a program which educates nurses, it looks at flow, it looks at equipment, it looks at dealing with insurers, and we're transferring that learning to the hospital as well.
Everything at a DISC ASC is designed and constructed for complex spine and MSK. That positions us to provide truly unique services to our patients. From the operating rooms to the recovery rooms, as well as the clinical model that we apply, everything is tailor-made to make sure that our patient outcomes get people back to their best lives more quickly.